If you believe everyone, no matter where they live, deserve a place to call home, you're not alone. On Housing for Good, host Chris Goodson and Karolyn Moore explore housing solutions from McPherson to communities across Kansas and beyond. We bring you stories and insights from housing experts, policymakers, and people who are making a real impact. Join the conversation. Listen wherever you get your podcasts, Apple, Spotify, Amazon, iHeart, and more, because housing isn't just local, it's universal.
Welcome to Housing for Good, a podcast dedicated to housing topics and issues affecting our communities in McPherson County and beyond. With years of experience and expertise, hosts Chris Goodson and Karolyn Moore discuss housing challenges and opportunities with other experts from a variety of housing fields.
Hi, and welcome to this week's episode of Housing for Good. I'm Karolyn.
And I'm Chris.
So, Chris, what do you have for news for us?
Well, today we're going to talk about the housing conference, the same thing we've been talking about for the last couple of weeks, September 25th. 8:30 a.m. to 3:30 p.m.
And you can find registration information on our website, McPhersonHousingCoalition.org.
And Eventbrite.
Eventbrite.
Yep. So, or if you go to one of our Facebook pages, there should be a link on there. You should be able to click on it, go right to it. I think it's only $25 this year.
$25, yep.
And that's only for the cost of the meal. So we're trying to lower that price so that everybody that's interested in what we're doing can attend.
Yeah.
We tried to really make that a lot lower this year. I know we're going to be talking about human trafficking. That's a really hard subject, and it's hard to believe that in our community, as small as we are, that we have that going on here. So I'm excited about, not excited about hearing about that, but at least excited about learning more about what we can do as a community to combat that a little bit.
And to continue the conversation.
Yes.
Those hard conversations just need to happen over and over and over.
Yeah, and so that's two things. And then the other thing at 2:15 p.m., so maybe you don't have time to go to the whole conference, but you're still interested in what we're doing. We're going to have a big countywide meeting again, and we're going to let you know what's been going on with the Housing Task Force, with our community meetings, with all those different things going on. That's going to be a really important meeting.
Yeah.
So whoever you are listening, and if you're from McPherson County, I would suggest that you come to that.
Yeah.
And then again, we're going to have some people from out of the area talking about how they're growing their communities.
Yeah.
So
absolutely.
I'm excited. That's awesome. And then the only other news I have is we are raising funds. We're trying to raise $200,000 for a matching fund that we have. And so if anybody's interested in donating to McPherson Housing Coalition to increase the size of our Sutherland Estates and build 5 more homes, that would be awesome.
Mm-hmm. Yep.
So anyways, that's pretty much the news that I have today.
Okay. Well, I'm very excited to hear from our guest today. We are being joined by Jeff Herndon. He is with the Robert J. Dole VA Medical Center over in Wichita.
Wow.
And so veterans is a topic we have never discussed yet, but there are a lot of components that go into what this medical center is able to do. So, Jeff, would you introduce yourself and just give us a brief synopsis or overview of the Veterans Administration?
Absolutely. Thank you for inviting me to join you today. I am a military veteran myself. I served 22 years in the United States Army before retiring, and then did some odd jobs with the USO and such before I got on with the VA as a public affairs officer and starting in 2019.
Well, thank you for your service.
Yeah.
Oh, my gosh.
That's exactly what I was going to say. That is just incredible.
I think, not to distract from the conversation, but if I remember right, something like 29% of VA employees are veterans themselves. And I think veterans don't realize you have advocates within the system, and we understand the issues that you have, the health challenges that you may face. And so we're really there to help you, as is all VA employees.
Yeah.
So,
awesome.
Yes. Let me start with a brief overview of the Department of Veterans Affairs. A lot of folks don't realize that it is divided into 3 separate administrations. There is the Veterans Health Administration, which I work for. That's if you have a primary care appointment, a mental health appointment, if you need a toxic exposure screening, that's what we take care of. So you have to apply for and be enrolled for VA health care. And we can talk about that a little bit later. Then there's the Veterans Benefits Administration. And the Benefits Administration, or VBA, is really, I like to look at it as anything to do with compensation or money. If you're filing a disability claim, if you're looking for, if you happen to qualify for a pension, education benefits, things of that nature, those all are dealt with through the VBA.
Okay.
And then finally, we have the National Cemetery Administration, which maintains our federal cemeteries and takes care of all of that type of business. So,
So we know that you're located in Wichita. The medical center is located there. What about the other two offices you talked about? Are they located with offices in Wichita?
So the VBA has a regional office in Wichita. It's at 9111 East Douglas. They cover the entire state of Kansas.
Okay.
So with the Veterans Health Administration, with the hospitals, the Robert J. Dole VA Medical Center, we are responsible for veterans living in 59 Kansas counties. So we've got a little more than half the state.
Okay.
And you have eastern Kansas that covers Topeka, Lawrence, that kind of eastern and northeastern part. And the Kansas City VA has a couple of Kansas counties up there near the Kansas City area.
Okay.
So, yes, we cover 59 counties. We're not just in Wichita. Starting in the late 90s and through the early 2000s, the VA came up with the concept of outpatient clinics. And so we have what we call community-based outpatient clinics, or CBOCs, in Dodge City, Hayes, Salina, Hutchinson, and then down in the southeast corner of the state in Parsons also.
Okay.
That gives veterans a lot more access.
Oh, yeah.
It really does.
To be able to have these benefits. This is really close to my heart. We have a lot of veterans in our family. Lots and lots of veterans.
Well, thank you for their service.
Yeah, my dad's actually in the Bakersfield, which is Kern County Cemetery. When he passed away, we were able to intern him there, and it's a beautiful, beautiful place.
Yes.
And then also, there's just a lot of things here. I'm actually a VA appraiser for real estate, so I do all the appraisals in this area.
Great.
For that. And so it just really, it's very close to my heart. All of this is so important. And we have so many veterans out there that we really need to provide for them.
Yeah.
And that I think sometimes people don't feel like that's happening. And it sounds to me like it is happening through what you're doing.
Through their service, veterans earned these benefits, and they are there for them, and they need to take advantage of them and utilize them. There are a lot of veterans out there who are not enrolled for VA health care, and that's for a variety of reasons. Some don't realize they're eligible. Some feel like, I'm young and healthy, I don't need it. That may be the case. Apply, get enrolled. If you don't need it today, you might need it 10 years from now, 30 years from now, who knows? And then from being enrolled in VA health care may stem into, we realize that you have a health issue that was due to your service, what we call service connected.
Okay.
And then you connect with the VBA and you file a disability claim. A lot of people think, I have to have some type of long-term health issue. I have to have some type of disability that's service-related in order to qualify for health care. You do not. There's just some simple rules. If you served 24 consecutive months on active duty, you received anything other than a dishonorable discharge, you are eligible for VA health care. Okay. If you were Reserve or National Guard, if you were called up on federal orders, they have to be Title 10 orders. I think the other one is Title 34. 34 doesn't qualify. It's Title 10. And you served the full duration of that period that you were called up. You are eligible for health care. There are some other intricacies out there, like, for veterans who served prior to 1980 and things of that nature. This is just apply. Get online and apply. If you look at the va.gov website, there's also an 800 toll-free number you can call, or you can stop in at any one of our facilities and fill out an application and let us be the judge of whether or not you're eligible. You earned it. I don't care if you're 25 or if you're 105. You earned it. Come take advantage of it.
Do you think people sometimes don't think that they qualify for whatever reason and they stop themselves?
Oh, I absolutely do.
Yeah.
Yes,
And so,
we're aware that is a reason that people don't do that.
So if you're listening to this podcast and you know someone who is a veteran, encourage them to apply.
That's right.
Encourage that, regardless if they think they're qualified or not, have them apply because you don't know if there's a benefit down the road that they may need.
That's right.
Exactly.
So,
And, the PACT Act, the Promise to Address Comprehensive Toxics Act, which was passed in 2022, signed into law in August of that year. It's a huge game changer for veterans. There's a lot of presumptive conditions now that if you served in a certain area and you have something like chronic bronchitis, there's a number of cancers out there, you are automatically eligible for VA health care. And oh, by the way, it's going to make qualifying for a disability claim a lot easier because that connection is easily made.
Wow. Okay. So what type of medical services are available to veterans at this center?
Well, we have a wide range. Obviously, we have primary care, and primary care is available at each one of the CBOCs as well. We have at least 2 teams at each one of those outpatient clinics, and we have, 14 or 15 primary care teams in Wichita.
Oh, wow.
So there's plenty of access to primary care. We've got a lot of specialty care clinics. We've got cardiology, oncology, pain management and rehabilitation. And if we don't have it, then we have access through Community Care Network to send you out for anything that you may need.
Okay.
So we hear a lot about PTSD or substance abuse that comes from serving. I think probably veterans go through a lot of trauma, I would guess.
Yes.
And how do you address that? You have mental health counseling. What does that look like a little bit?
So we do also have mental health there on the campus. It's important to note that if you are an existing mental health patient and you are having a crisis, you don't have to have an appointment. We have walk-in clinics. It's in Building 5B on the campus. We have walk-in clinics. You can call and leave a message. Hey, I need to talk to my provider today. You will get called back. So you don't have to have an appointment if you're an existing patient. And even if you're not an existing patient, if you feel like you're in crisis, you walk into the clinic, we're going to do our best to get you enrolled and get you seen that day. We have a wide range of counseling services available through our mental health clinic, and that includes counseling for PTSD. There's individual counseling. There are group sessions. There are group sessions that are available in the evening for those who are younger and have to work. Some of these are led by other veterans and peer counselors as well. So you're not always just sitting there on the couch talking to the shrink, like we all imagine in our heads.
Does that include family members? Family members of the vet that they live together, they're trying to help their loved one with PTSD that they're dealing with. What kind of services do they offer for the family?
We have supportive services.
Okay.
We do have marriage counseling available. I'm not sure if we have something where we have like the family and the veteran together in one session. If we did that, that would absolutely be an individual session. And I don't think in a group setting where you'd have multiple veterans in there. We have a caregiver support program. If you are designated as a caregiver, you are eligible to enroll in that program. There's 2 aspects to the caregiver program. One is for those who require a bit more intensive care because there are certain daily activities they can't do for themselves. And then there's another aspect of it that is more general program that caregivers, family members can take advantage of as well.
Okay. Oh, that's great support.
Yeah, I just think, if you have a loved one, your spouse has been in the service and they are struggling, to be able to know how to help. I don't even know how to phrase it, but just to be there to support them, to help understand kind of what they're going through would be tremendous.
It's absolutely important. And then another aspect of VA are the vet centers. We have a vet center in Wichita, and family members in some instances, there's some qualifications to use the counseling services that they have there. and I'm not a vet center employee, so I can't really testify to those here. But they do counseling with family members, with veterans in certain circumstances at the vet center as well.
Good.
So we've kind of talked about the eligibility requirements. I think basically the answer to that question is apply.
Yeah.
Apply. Don't worry about whether you qualify. Just take the time, fill that out. It's online. I'm guessing it's a somewhat simple process. And then if they can't figure it out, because not everybody's tech savvy depending on your age, they could walk into the center then maybe and have somebody help them?
They could, absolutely.
Is that a possibility?
We have, so we're like really one big building in the main facility, but they're all connected together. So on the northwest side of the facility is Building 61, where we have a lot of administrative functions.
Okay.
Immediately inside that door is our eligibility and enrollment office. And those folks can sit down, talk with you, help you through the process of applying. Generally speaking, they can look at your application and say, yes, it appears you're eligible. But the official determination comes from what we call the Health Eligibility Center, which is down in Atlanta. But that just takes days, okay? I applied on a Saturday. The next Saturday, a week later, we call it the HEC. The HEC called me and said, hey, congratulations, you're eligible for VA healthcare. We're getting you enrolled. You should get your official paperwork in about a week to 10 days. And sure enough, about a week later, I got my packet in the mail. And then the medical center reached out to me and said, hey, we're going to assign you to a team. Let's get you in for your first appointment.
Wow, that's very efficient, isn't it?
Yeah.
So we try. We really try.
Well, I will say for the VA appraisals that I do, there's a portal that I sign into, and it's very quick and easy. I mean, it's pretty sophisticated, really, how well that we're able to get those done. And they have a certain requirement that how many days I have to get it done. I think they want to get back to the veteran and let them know that this is being held up by red tape or something.
Yeah, absolutely.
So, I've experienced that.
You know, you go back maybe 20 years ago, you're buying a home as a veteran. You had to go to the VBA and get a certificate to then take to your mortgage lender. That's not the situation anymore. The mortgage lender really takes care of all of that. I think all you got to do is show them your DD-214, your discharge papers, and they take care of all of that for you. It's the same thing with your education benefits. You decide the school that you want to go to. When you go to enroll and you say, hey, I'm a veteran, they're automatically going to connect you with their Veteran Services office and get you in there to get to activate your GI Bill benefits.
Yeah, and that's all online as well.
It is.
Because I go to a school right now where, because I'm a child of a veteran, I get discounted tuition. It's pretty awesome.
And there are a wide range of benefits for survivors as well, or for those who may not have passed but might have like a disability rating of 100% or things of that nature. A lot of those benefits will get passed on to the family members. So it's important for people to check that out.
Yeah, I will say I agree with that totally. So if you want to coordinate care with a health provider, maybe they're not part of the veteran system. Somebody, I don't know what that would be, a cardiologist or maybe somebody that you don't have within your system. Do you coordinate then with those outside people, or do you take it over? You just have it.
So a veteran comes in, they have a primary care appointment. The primary care provider determines that they need to move on to a specialty clinic for something. If we don't have that service in-house, once the consult for that is, or the referral is submitted for that service, we have a department called community care who automatically picks that up. And we have providers who are enrolled in a network with us. And then they start looking for that to schedule that appointment for you. And of course, they're in consultation with the veteran. You know, I have this provider, you're going to have to wait X number of days. They're 10 miles away from you. We have this provider, you'll have to wait X number of days, but they're only 3 miles away from you. And they'll work with the veteran to coordinate that appointment.
And all this is free?
Generally speaking, yes. It depends on a few factors. Number one, if you're being seen for something that is service-connected, it is absolutely free. Number two, if you have a certain disability rating, certain level of disability rating, you move into what we call a higher priority group, and most of the services that you receive are free. Me, for example, I don't have a disability. I was in telecommunications, didn't have to do a lot of that rugged hard work. And so I don't have a disability right now. I don't have a bad knee or a bad back from jumping out of a plane or anything like that. So I'm in what you call priority group 6. And because I'm in priority group 6, I have copays.
Okay.
And anytime I go see my primary care provider, it costs me $15.
Okay.
That's dirt cheap.
That's doable.
So, yeah,
that is
absolutely.
doable. If does it go by income at all?
It does. Yes.
So if I'm a homeless individual or struggling, then you take that into account a little bit?
Absolutely.
Okay.
Income is absolutely
because there's lots of veterans out there that are homeless, unfortunately, and so I could see them maybe not going to the center or not being able to get on a computer to go to the center or worrying about the funding part of it. And so we need them to know, or if somebody knows somebody to let them know about that.
So you mentioned appointments. Maybe there's a provider that's 10 miles away or one that's 3 miles away. Do you guys help at all with transportation?
Again, we do have a transportation department, and then we also have transportation provided through disabled American veterans.
Okay.
There are certain things to qualify to use that transportation service. There is also, we have a subscription service with Uber for a little bit longer distance travel.
Okay.
So there are a number of different options. Absolutely, if you are unable to transport yourself, you're in a wheelchair or something of that nature, you don't have a family member to take care of you, we're going to be able to transport you to your appointments.
Okay. And Chris mentioned homeless veterans. So do you have any idea how many homeless veterans we have in Wichita?
So in Wichita, we now have a by name list. So first of all, we participate in United Way's what they call point in time count every January. And so we have got staff out there, including our medical center director, every year for at least the last 5 years now. The medical center director gets out there and participates as well. You know, looking under bridges, exploring the parks.
Sometimes they're hard to find, actually.
And making contact with those homeless veterans. You are correct. So our by name list right now, out of that point in time count, we establish a by name list. I think it started out this year right around 40. We're down to 28 right now.
Wow.
Oh, wow.
Okay.
So you somehow you're connecting with them with housing, or are you not part of that, trying to find housing? And
Oh, we are absolutely. We have a homeless program team.
Okay.
Our team is phenomenal. They work very closely with the community. And, oh, by the way, they're not just focused on Sedgwick County. They are focused on all 59 counties. I recently read a story about Garden City having more higher volume of people looking for shelter because of the heat that they were having out there this summer. So when I got to work on Monday, I reached out to our program supervisor and I said, hey, Kenny, I just saw this article. You know, we might want to reach out to Finney County and make sure that they are aware of everything that we have. And Kenny said, we're already housing 2 veterans from Garden City.
Oh, that's awesome.
That's how good our team is. They make contact with law enforcement agencies and nonprofit groups throughout our 59 counties so that they know we're here to support them. That said, yes, the vast majority of homelessness in our area is in Wichita. And so we are actively engaged. I think you know. Homelessness is a dynamic environment. You might house 3 people one week, and what you don't know is that there are 3 more entering homelessness.
Yeah.
Or
it moves.
There's that plus and minus routinely. And so our goal is to achieve functional zero in Sedgwick County, meaning we have the resources available to house somebody when it is needed, that homelessness is non-recurring, it's brief, and that we deal with it as quickly as possible.
Yeah.
So,
does the VA have housing specifically that you own, like apartment complexes or individual homes?
We have what's known as the Emporia House in Wichita. I think they named it that because it's on Emporia Street.
That's how I like to name stuff.
Clever.
I know. That's why how we name our stuff.
Yeah.
Oak Harbor Cottages, Southern Estates, right on those streets.
So we provide many of the funds to operate that. I think the vast majority of them, but it is MHA, Mental Health Association, whose staff is actually there running it. But our social workers, our homeless caseworkers are out there routinely visiting with those veterans. We've got a great system where we provide what we call wraparound services. You know, we have an employment coordinator who's working to get homeless veterans jobs, or those that we've put into temporary shelter, getting them jobs. We've got spiritual counseling available. If they've got a substance abuse issue, we get them enrolled into one of our programs to address that substance use. And so we just do everything. And then, oh, by the way, you know, when you move into an apartment, if you don't have a shower curtain, you can't take a shower. If you don't have a pot to cook in.
People don't think about all those little things.
And so you end up right back where you were, what you knew. I know I can go down by the tracks and get dinner from Johnny. And so we provide them with move-in kits as well.
Oh.
So
is that Emporia House, is that a permanent place or is that a temporary shelter? Is it a halfway house? What is that exactly?
I would term it, if you wanted to look at it, it's really more of a halfway house. I think with temporary shelter, the goal is to move them out of that within a very short period of time. I think it's like 14 days maybe.
Ours is 90 days. We have a 90-day shelter.
Is it 90? Okay. I think within the temporary shelter realm, there are multiple levels of that. Like we get you into a shelter where we know you've got a bed right now tonight, but then we start looking for somewhere that you can move to that's a little more stable, a little more permanent. And then, of course, the goal is eventually to move them into permanent housing. So Emporia House, I know that veterans can have extended stays there. I'm unaware of exactly what the limit is on that. But also, you're not going to get placed in Emporia House without working with our team to do that. You can't just walk up and knock on the door and say, hey, I need a room tonight.
Yeah. So. Well, and I love how you said that you give them wraparound services, because the one thing that we have learned in the work we do here in McPherson is you can't just house somebody and put them in a house and walk away. They need much more than that. And the longer they've been homeless, the more support they need, the longer it's going to take for them to feel comfortable living in a house, being, behind a door kind of thing. And so it's so important. So what about rehabilitation programs with physical disabilities or injuries? What do you guys have to help with that component?
So we have both physical therapy and occupational therapy. And if you're referred to those programs, you're going to be enrolled in them for as long as necessary. I just recently went through our physical therapy program, and they evaluate you, and if necessary, then they send you on to a different specialty provider. So they are constantly evaluating you. Do I need to move you out of this program and have you go see the surgeons, or, is what we're doing effective? In addition to that, we have our prosthetics department, which if somebody qualifies for a wheelchair, something of that nature, if their house needs to get modified to accommodate the wheelchair, you can work that through our prosthetics department. From an employment perspective, we have within the VHA in our hospital, we have compensated work therapy, which is really designed to help somebody who has been out of a work environment for a long time kind of get used to being back there again. So you're not immersed full time right off the bat. You may not go to work every day. It's kind of a gradual increase until we get you back up to where you're working 40 hours a week and you have learned a skill in the position that you're working in.
Oh, that's awesome.
And then if you go through the VBA, they have the Vocational Rehabilitation and Education Program. That's a little more strict with the qualifications for that, but they can get you into education where you completely learn a new skill and things of that nature. So,
wow, that's very impressive.
So we've talked about transportation, and you do have counseling and support groups for families and for the veterans. And we've talked about a lot about housing and homelessness and all of that. But are there other community resources or partnerships that you have?
Ooh, that's a good question.
We finally stumped him.
Yeah.
I was hoping that maybe, no, I'm just kidding. We try not to stump people, but I didn't know if there was anything else that I just want to make sure really that we're not missing something.
From the perspective of that, we don't have a lot of documented written agreements where you're going to do this and we're going to do that. We have a lot of organizations that want to work with veterans, and they find that working with us is the best way to do that. So you look at the veteran service organizations, the VFWs, American Legions, Disabled American Veterans. They work very closely with our Volunteer Services Office, which is now known as the Center for Development and Civic Engagement. So our CDCE chief might get a request to support a veteran. This guy's refrigerator just went out. He doesn't have the funds to replace it. So our CDCE chief will reach out to those veteran service organizations and say, hey, we have a veteran who's in need of a refrigerator. And we can usually accomplish things through that method. We also have a program called Veteran Community Partnerships, which started out of the geriatric and extended care program. So we have a lot of like health and home hospice organizations involved with that, but it's not exclusive to that. We do also have some nonprofits that work with that group, and they have a couple of goals. Number one, they want to ensure that veterans are aware of resources, but also that providers are aware of resources that where they can support a veteran. And then they also, through that, they do a lot of education with those community providers out there. So
we have our local American Legion actually partners with us. We have a program called Brush Up Mac that helps seniors stay in their homes, and they will install a wheelchair ramp for any veteran.
That's great.
in our community.
Free of charge.
That's free of charge. And so, I mean, we do support that financially somewhat, if it costs money for the wheelchair ramp, but they will do that for us. And
But you could probably be doing other things with those financial resources, right? Other good?
Yes, we could. I mean,
so you should make sure that those veterans are, number one, enrolled for VA healthcare, and then number two, working with our prosthetics department for any modifications that they need to their home. I forget the exact name of that.
That's awesome. See, I told you.
Yeah.
Supportive home adaptation or something like that. So,
So, and are you the contact for that? Or not you specifically, but again, do they enroll in the healthcare and then that's how this all happens?
Yep. And our main number is 316-685-2221. I know that, generally speaking, we don't get charged for long distance calls anymore, but I know there are some folks out there who are concerned about that. So we do have a toll-free number also. It's 888-878-6881.
Okay.
Oh, this has been a great interview.
It has. I love this. So how do veterans provide feedback about the services they receive? A lot of it is if we don't know where the gaps are or how we maybe didn't do what somebody needed, you don't know what to change or what to amend. How would a veteran give you feedback on their services? Great
question. First of all, we send out a lot of surveys after a veteran has an appointment and ask them, please fill out this survey. So when we get that feedback, they have the opportunity to tell us both what we're doing good and what we're doing bad. I can tell you one of the questions they are asked to answer is, I trust Dole VA for my healthcare needs. Our trust score, 95.2% of veterans say they trust the Dole VA.
Oh, yay.
We're doing good things according to veterans, but we do get some feedback that, hey, this could be better, that could be better. We have a patient advocate office, which we actually refer to as the Veterans Experience Office. They can file a complaint with them. I always tell everybody, resolve problems at the lowest level. So if you have a problem with your primary care provider, have a conversation about that. But the bottom line is, if you're not comfortable doing that, or if you've done that and it's not improving, there's a variety of ways to let us know. And then we even have an informal method that we call Speak to the Director. You can fill out a Speak to the Director form online. We have printed copies throughout the medical center. You can grab one, sit down with a pen and fill it out and drop it in the box. It's a locked box, so nobody's going to go pluck it out and throw it away because you were complaining about it.
Look what this person said.
And so we take that information and we have what we call continuous process improvement. We have a lot of teams that sit down, evaluate data, evaluate other feedback that we get and say, what's the problem? That's the first thing you got to do is what's the root problem here? So you got to find the root problem, then you have to develop a plan of how we're going to fix that. And they do that very quickly. I feel like we're really good at that. And we're striving to become what you call a high reliability organization. And in order to achieve that, you've got to be working to improve every day, every day. So.
Well, wow. I have learned so much on this podcast today.
Too.
So first of all, I just want to say, if you're a veteran, thank you for your service. Thank you for what you've done for this country. And if you know of somebody that would be interested in being on Housing for Good, drop us a line, leave us a review. You can do that at housingforgood@mcphersonhc.org. Thank you for joining us today.
Yes, thank you very much. I want to say thank you to our guests. This was really awesome, and have a great day.
It's a great opportunity. Thank you very much.